Welcome to Marian Ayurveda. In today's informative episode in Chinasuo, we are going to take a deep dive and discuss in great detail exactly what foods fistula patients can eat and which specific foods they should avoid. In a previous video we shared earlier, we had already made a detailed guide about how to cure a fistula or how to effectively dry up the fistula tract. In that video, what we explained was this. By reducing abdominal water retention or acidity, taking medicines for that, and using special drops through the anus to dry up the acidity or the tract, we can dry up the fistula. With such a treatment approach, we were able to provide relief to many patients, meaning we were able to dry up the fistula without any surgery at all. However, in rare cases, even after using such medicines, when the fistula did not dry up, it was only after we started thinking about the reasons behind this that we realized that after consuming certain foods, it becomes impossible for us to dry up the fistula. So in this video, I am going to talk about which specific foods fall into that category. I am Dr. Anumod Kakkassery Marian Ayurveda Thrissur. For the past 1 or 2 years, we have been treating a lot of fistula patients. What I am about to share with you now is information I have received from them. Each patient gives us a lot of information. Now, there is something very common among these cases. As we know, the disease called fistula, as we have mentioned before, it never develops without acidity in the stomach. A disease called fistula does not occur without fluid retention in the stomach. Therefore, we should avoid all foods that cause fluid retention or acidity in the stomach. It's not a big deal. These are all very simple foods. So if we pay attention to that, we can successfully overcome this disease comfortably. For example, if we look at a patient who came in yesterday, he doesn't have major problems with fistula, but in very rare cases, it can worsen. But if you ask what his biggest problem is, the main factor that aggravates his fistula is his habit of drinking tea continuously. He drinks 2, 3, or even up to 4 or 5 cups of tea a day. Now, we know that tea ranks first when it comes to causing acidity. Many studies have explained the role of tea in causing inflammation in the stomach and acidity. That is why for people who drink tea, no matter what surgery we do or what medicines we give, it is impossible to completely cure fistula. Therefore, tea should be completely avoided. Compared to tea, coffee is a drink that causes even more water retention. Definitely, we should avoid coffee. Patients with fistula should avoid coffee. Instead, we can choose to consume milk and fresh water. Or we can incorporate some highly beneficial ingredients, such as aromatic cardamom powder, into the milk and drink it for our health. The fact is, unless you switch to such a lifestyle, it will never be possible to cure this fistula. So, just like tea and coffee, another food that causes water retention in the stomach is pickle. There are some people who will eat only pickles and are ready to give up everything else. But as long as you keep eating pickles, it will never be possible to cure a fistula. Therefore, we know that when we talk about pickles, it is a food that includes all the things that are not suitable for fistula. Pickle is something that contains spiciness, sourness, and salt, all three together. So as long as we keep eating pickles, we will never be able to treat or cure fistula. Similarly, another major food item commonly consumed by fistula patients is papad. We know that papad contains ingredients like apakaram that cause water retention in the stomach. Once that happens, it leads to acidity in the intestines. Because of that, it is not possible for us to heal the fistula in a person who consumes papad. Therefore, it is absolutely essential that we avoid papad. Similarly, we should also avoid spicy, sour, and excessively spicy masala preparations. That is, some people say they want extremely spicy food. There are people who use bird's eye chili, kantari mulaku. It is said that bird's eye chili should never be used. Fistula patients should never use it. And by eating bird's eye chili, it is not possible for us to heal the fistula. The chili powder to be used at home should be made from Kashmiri chilies. That is, you should use a type of chili powder that is not spicy. Similarly, it is very important to significantly reduce the use of black pepper, garlic, ginger, and such ingredients. Use only 1/4 of the usual amount. As I said, ingredients like kokum and tamarind, which are used in fish curry, should also be minimized as much as possible. For example, if you normally use 2 pieces of kokum, reduce it to just half a piece. It is absolutely necessary to reduce the amount of tamarind to just 1/4. Similarly, fermented foods such as curd, buttermilk, and paneer can also aggravate fistula. In the same way, fermented foods like idli, dosa, and appam, when their sourness enters the body, can also increase the chances of aggravating fistula. Similarly, certain small limes are also included in our diet. Even just small lime is enough to prevent the fistula wound from drying up. So, patients with fistula should avoid sour fruits like small lime, orange, musambi, pineapple, grape, mango, and similar types of fruits. Instead, we can eat fruits like papaya, guava, pomegranate, dragon fruit, apple, and other such fruits. Similarly, we should avoid all items bought from the bakery, That is biscuits, soft drinks, all these cause irritation in the stomach. So it is very important to avoid such items, bakery products, and foods like shrimp and mackerel. Shrimp and mackerel are the ones that especially cause water retention in the stomach and trigger allergic responses. Similarly, we can eat river fish, all kinds of river fish, and dam fish as well. Compared to sea fish, these types of fish are better. Among sea fish, we can try to eat fish with scales. That is something we can attempt. For vegetarians, this is very important, and there are some who are vegetarians. They mainly, sometimes after a patient comes in, follow all these things that have been mentioned. But now, all of a sudden, there was some dryness, and then the symptoms started. Upon checking and talking, it became clear that for the past month, they have been regularly consuming moringa leaves. Therefore, moringa leaves can be a substance that has the potential to cause serious harm. Similarly, horse gram curry, it is hot in nature and it contaminates the blood. Therefore, avoiding horse gram curry is also a very good thing. Similarly, another important food to mention is dates. After a patient recovered, everything had dried up completely and there were no issues at all. Recently, they started eating dates regularly, having 2 or 3 dates a day. We know that dates are a substance that increases blood or something of that sort. So after starting to eat dates, a slight wetness or discharge started to appear again. When dates were stopped, it dried up. Similarly, beetroot can also be included in that same category. Similarly, for those of us who eat non-vegetarian food, we know that chicken eggs, country chicken and country eggs can be a bit problematic. Among those, after the matured items have dried well, if needed, we might be able to consume them. But during a certain matured period, we should avoid chicken eggs, country chicken, and country eggs. Instead, eating foods like duck eggs, duck, beef, goat, and buffalo in that category does not seem to cause any major problems. Some people are allergic to beef or to buffalo meat, and such individuals should not consume those. So if we pay attention to our diet in this way, this condition can be completely cured. Fistula is not such a severe disease as people think. Apart from what I have mentioned here, there will often be many other foods in each of our daily lives. In addition to the things I have referred to, there will be many more items. So what we need to pay attention to is that when you take the medicine, the medicines that I mentioned, the drop medicine that we talk about, once you use it, the fistula will dry up. Once it dries up, it does not cause us any major problems. If during this period when it remains dry, you suddenly notice after eating some food or on any given day that there is a slight swelling, a bit of discharge, or a mild pain, you should immediately think back and check what foods you ate the previous day or the day before that. Then you will realize that apart from the foods we mentioned, you must have eaten some other specific food. That is what causes the fistula to become moist or painful. Once we avoid that particular food, it will immediately start to dry up. In the same way, if you suddenly experience pain, what can we do about it? One thing we can do is to crush either neem leaves or chitamruthu leaves, which are easily available near our homes, and apply it. This will immediately dry up the pus from the fistula and cause it to retract inward. This can help to relieve the pain as well. So sitting in warm salt water that is not too hot, or in water boiled with neem leaves, is very beneficial. Along with these methods, another important thing to note is that applying oil to the head or engaging in excessive exercise or any activity that causes the body to overheat can actually worsen the fistula. Therefore, for some people, if they apply oil prepared with black pepper or fenugreek to the head, the fistula will not heal. Similarly, when using cushions, make sure to use ones that do not put pressure on that area. If you are someone who has to sit and work for long periods, make sure to stand up every now and then for about 5 minutes so that excess heat does not build up in that area. If you pay attention to these kinds of small things, this is not a major problem. It is a condition that can be managed and cured. So let's meet again in another episode. Thank you.